So, hello everyone. With me, I've got yet another top ranker, Dr. Mayur, who has secured All India rank 98 in the NEET SS Medical Group entrance examinations. So, Mayur, welcome and hearty congratulations.
Thank you. Thank you so much, sir.
So, Mayur, let me ask you the obvious question:
Yes,
how
sir.
are you feeling now?
Sir, I'm elated actually. Matlab, I just completed my residency yesterday. So doing all this during my residency was tough, but with Almighty and all the hard work, I think I achieved a good rank, sir.
Right,
I'm
great,
very
great.
happy. My parents were very proud. My friends are super happy, sir. Because coming from peripheral college, it means a lot
Correct.
to have this kind of rank, sir.
And especially the last few months would have been
Yes,
very
sir.
stressful,
Yes, sir.
especially having your residency, the preparation for MD finals, then the NEET SS pattern,
Yes, sir.
it's
It changed
very
suddenly.
unpredictable as always, and to get this amazing rank, and now you can decide on the branch that you like, the college
Yes, sir.
that you like. You've got such a wonderful rank. Lots of congratulations for that.
Thank you. Thank
Now,
you so much.
Mayur, can I know more about yourself? From where are you, and from which college did you do your MBBS and then your post graduation also?
Sir, from a small town, Selu, which is Parbhani district in Maharashtra. I
Okay,
completed my MBBS from TNMC and Nair Hospital, Mumbai.
okay,
And then I did my post graduation from GMC, Aurangabad, Maharashtra.
okay, great, great.
Yes, sir.
And I think it's a phenomenal achievement. And
Yes, sir. Thank you.
see, I just want to know from you, especially your advices will be helping the medicine residents, especially those who are planning to crack the NEET SS in the first attempt.
Yes, sir.
So once your residency was coming to the fag end, and in the months of Jan, Feb, March, what was your approach? Because obviously you had to practice a lot of MCQs because NEET SS is a different ball game. You have to
Yes, sir.
have good MCQ practice. So how did doc tutorials help you in your MCQ practice, starting with the Q bank?
Yes, sir. So what I had done was during my second and third year of residency, I did not get much time during my first year. So during my second and third year of residency, I read Harrison according to the patients which were admitted in the ward, sir. So
Okay,
whenever my faculties used to tell me a patient of specific, if there's a patient of SLE admitted, so I used to read SLE thoroughly. And then, sir, I had opted for two quizzes, sir. I had gone for a hemat and rheumat zonal round, sir. So that helped me. So, matlab, that developed more interest for me in the subject of medicine, sir.
yeah,
So read them thoroughly, and then at the fag end during my university exams, I focused on the systems, sir, which are the core of medicine. So I read the second volume thoroughly during that period, around October November. Sir, doc tutorials had started a mini test series back then. So I used to till my 2 days before my university exams, I used to go through with that mini test. So I used to solve them every day at least matlab, I was thinking ki at least if I do something every day that will help me in the back end. So I used to solve those MCQs and that topic used to get thorough because the syllabus what we study for universities is very different from NEET SS.
right.
So yes, sir, the core systems I did during those months in November, December, January, and then when my practicals got over, sir, I took a 5 days ka break and then I started thoroughly. Then I started doing the first edition of Harrison, and along with that, I used to solve systemic MCQs, sir. MCQs from systems from doc
Okay.
tutorials, sir. Yes, sir. So that helped me revise the majority of the systems from Harrison Volume 2, sir.
And many students ask me, sir, those who have already subscribed to Doc Tutorials, they do ask me, sir, what percentage of QBank should be done? So I've seen some of them doing entire QBank, some of them 80%, 70%, but I think you have to do a minimum of 60% of QBank. A minimum
Yes, sir.
is what
Yes,
I
sir.
feel. So I would like to have your opinion as well on what percentage of the questions have you done from the QBank?
Sir, smaller systems and the systems which we don't read thoroughly during a routine practice, I solved all all the modules in the doc tutorials app from those systems. And then from the more extensive systems, I could not solve the entire thing because I did not have that much amount of time. So approximately solved smaller systems, all the modules, and 70% of the rest of the bigger systems.
Great, 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 great. I
And
think I've,
then,
yeah, please,
yes,
please.
sir. Sir, whenever I used to give grand test, the topics or systems which I'm lacking in, then I used to go back to the question bank and solve those modules again. So that used to help me boost my confidence, sir.
Right. Right. And what about grand test? How frequently were you giving the grand test in the month of Jan, Feb, March?
So, sir, after my completed my MD final exam, I gave every grand test that was live on the app, sir. So that helped me, and the majority of tests I used to be having a double digit or single digit ranks, sir. So, matlab, that helped me boost my confidence. You know, ki everybody, matlab, I back because we didn't have any, we were freshers, so we didn't have any MCQ wala exposure before the MD final exams. But when we started giving grand test, it gave me confidence that we can do this. It's matlab, it's achievable. So, sir, whenever I used to give grand test, I used to write down the list of topics I was wrong at. More importantly, the questions which I used to guess, sir, because those questions in the end make a difference. Because at that moment we think that we marked this correct, but the logic behind that question, how we marked it correct, was different. So the right logic should be applied to that question. So I used to make a list of topics which are wrong and the which ones I guessed correct. So, and then I used to go back to them, read from Harrison or solve MCQs for them, and that used to help me a lot, sir. And then steadily I used to get better at it, sir.
Great, great, great. And were you happy with the standard of questions in the doc tutorials QBank as well as the grand test, and were the explanation of satisfactory level so that you can understand your mistakes?
Yes, sir. When I used to solve an MCQ, the surrounding portion of that was also given in the explanation. So if I'm
Yeah,
solving a module, that will cover my entire topic. Even if I've left something to read, I can't recollect. So solving these MCQs will help with that, sir. So that used
right.
to help me. Yes, sir.
Great, great. And what branch are you planning to take? Have you decided?
Sir, I'm actually confused between two. I like rheumatology. I've always wanted that branch, and I'm also thinking hematology, sir. So I'm going to choose between the two of them.
And it's a good confusion to have, because when you
Yes,
get such a good rank,
yes,
more doors are open to you, more
yes,
colleges, and at your disposal you can take the branch that you like. And I'm so happy for you for
thank you.
the effort that you have put in and the amazing rank that you have got. So once again, thank you so much for
Thank you,
joining,
sir.
and hearty congratulations.
Thank you, sir.